What if your body has been warning you about diabetes for months, and you have been looking in the completely wrong place? Most people wait for the classic symptoms: extreme thirst, constant fatigue, blurry vision. But by the time those symptoms appear, diabetes has often been silently damaging your body for 2, 3, sometimes 4 years already. Here is what almost nobody tells you. 2 full years before those obvious symptoms ever appear, your body is already sending you 9 clear, visible warning signals. And every single one of them shows up in the same place. A place most people never think to look: your feet. I am Dr. James Carter, and in today's video I am going to walk you through all 9 warning signs of diabetes that can appear on your feet, including sign number 7, which surprises almost every patient I have ever shown it to. Most people have absolutely no idea this one is connected to blood sugar at all. So make sure you stay with me until we get there. Before we go through these 9 signs, let me give you one number that should make every senior watching this sit up straight. The American Diabetes Association estimates that 1 in 5 Americans living with diabetes right now does not know they have it. That is over 8.5 million people, going about their day, reheating last night's dinner, sitting in their favorite chair, with a silent condition already damaging their nerves, their kidneys, and yes, their feet. If that number surprised you, please share this video with someone you love before we are done today. It could genuinely change their life. Sign number 1, tingling or numbness in the toes. Now, before you tell yourself this is just poor circulation or that you sat with your legs crossed for too long, let me explain why this specific sensation is different and why it matters. When your blood sugar runs too high for too long, it starts to damage the smallest, most delicate nerves in your body. And where are those nerves? They are at the very tips of your extremities, your toes. The medical term for this is diabetic peripheral neuropathy. And here is the critical thing. It does not announce itself with sharp pain at the start. It begins quietly, with occasional tingling, a slight numbness, a sensation like your toes have fallen asleep even when you have been walking around all day. Tonight, before bed, sit down and do a simple test. Run your finger gently across each toe. Does each toe feel the same? Press lightly on the ball of your left foot and then your right foot. Any difference in sensation between left and right is worth paying attention to. Write it down. Sign number 2. Burning or shooting pain in the feet at night. This one often gets dismissed as arthritis or restless legs, but there is a very specific pattern to diabetic foot pain that separates it from those conditions. The pain tends to be worse at night. It often feels like burning, like electric shocks, or like walking on broken glass even when you have been resting for hours. It can wake you from sleep, and it frequently appears in both feet at the same time, rather than one side, the way an injury would. What is happening beneath the surface is that your nerve fibers, the ones that signal pain, have become damaged and are essentially misfiring. They are sending pain signals to your brain even when there is no actual injury. The driver of that misfiring is chronically elevated blood sugar. If you have been waking up at night with burning feet and telling yourself it is just the way things are as you get older, please do not accept that. Keep a simple journal for 1 week. Note which nights you feel the burning, how intense it is on a scale of 1 to 10, and what you ate that day. That pattern is valuable information for your doctor. Sign number 3. Cuts, blisters, or sores on the feet that take unusually long to heal. This is where we move from uncomfortable to genuinely serious. Let me explain why this particular sign should never be dismissed. When blood sugar runs chronically high, it does 2 damaging things to your wound healing ability. First, it impairs your immune cells, the white blood cells that fight infection and clear damaged tissue. They become sluggish and less effective. Second, it damages the tiny blood vessels that carry oxygen to your skin. Without adequate oxygen, your skin simply cannot repair itself at normal speed. A small cut on a foot that should heal in 5 to 7 days might take 3 or 4 weeks in someone with uncontrolled blood sugar. And every day that wound stays open is another day bacteria can get in. I want you to do something right now if you can. Take your shoes and socks off. Look at the soles of your feet. Look between your toes. Is there anything there you did not know about? Because one of the most dangerous things about this sign is that people often do not feel wounds on their feet because of the nerve damage we just talked about in signs 1 and 2. You can have an open wound and feel nothing. Any wound on your foot that has been open for more than 2 weeks without significant healing should be shown to a doctor this week. Not at your next scheduled appointment, this week. Sign number 4. Brown, reddish, or darkened skin around the ankles. This is one that most people have never connected to blood sugar at all. Look at your ankles right now in good natural light, or ask someone you trust to look for you. Do you see any brownish, reddish, or darkened patches of skin around the ankle bone, particularly on the inner side? This is not a bruise, and it is not a skin allergy. It has a specific medical name: hemosiderin staining. Here is what causes it. Diabetes gradually damages the small blood vessels called capillaries in your lower legs. When these tiny vessels become leaky or partially blocked, red blood cells start breaking down in the surrounding tissue. Those broken down blood cells leave behind a brownish pigment, the same pigment you see when a bruise fades. But in this case, it deposits permanently around the ankles. It is a visible marker of compromised circulation in your lower body, and it is almost always present before more serious complications develop. If you see it, write it down and mention it at your next doctor's visit. Before I show you sign number 5, and especially before we get to sign number 7, which I promise will surprise you, I want to ask you something. Have you noticed any of the first 4 signs on your own feet right now? Even one of them? Type yes in the comments below. I personally read every single comment on this channel and I will respond today. Sign number 5. Severely cracked or extremely dry heels that will not respond to moisturizer. Now, almost everyone gets dry heels at some point, but what I am describing here is different. A level of dryness and cracking that persists despite regular moisturizing. That keeps coming back no matter what cream you use. Here is why this happens. Your feet have sweat glands, and those sweat glands are controlled by a branch of your autonomic nervous system. When diabetes damages those small autonomic nerve fibers, the sweat glands in your feet essentially stop working properly. Less sweat means less natural moisture, and the skin of your feet becomes chronically and severely dry from the inside, not from external conditions. The key distinction is treatment resistance. Normal dry skin responds to moisturizer within days. Diabetically dry feet often do not, or it responds briefly and then reverts completely within a few days. If you have been putting cream on your heels for months and they keep cracking right back open, that pattern is medically significant. It is not just dry skin, it is a nerve signal. Sign number 6, persistent swelling in the feet and ankles. Let me give you a very simple test you can do right now while you watch this video. Press your thumb into the top of your foot or into your ankle. Press firmly for about 10 seconds. Now release. What happens to that indentation? If it springs back quickly, your swelling is likely positional and related to being on your feet all day. But if that indentation stays for more than a few seconds, if it holds the shape of your thumb, that is called pitting edema. And pitting edema in both feet and ankles is a flag that deserves medical attention. In the context of diabetes, persistent edema points to 2 things. First, leaky blood vessels that cannot hold fluid properly due to vascular damage. Second, and this is the one I want you to hear carefully, it can be an early sign that the kidneys are being affected. The kidneys play a critical role in fluid balance. When they are under stress from chronically high blood sugar, one of the first visible results can be fluid accumulating in the lowest part of the body, your feet and ankles. Sign number 7. This is the one I told you to stay for. I want you to do something right now. If you are wearing trousers or long socks, please pull them up. I am serious. Look at your lower leg from the ankle to about mid-shin. Now look at your upper leg. Is there a noticeable difference in how much hair there is? Now look at the tops of your feet, the tops of your toes. Is there hair there? Because here is what I see constantly in my practice, and it is a sign that almost no one, including many primary care physicians, connects to blood sugar. When diabetes damages the blood vessels supplying the lower legs and feet, hair follicles in those areas stop receiving adequate blood flow, and hair follicles without blood flow stop producing hair. The hair does not thin gradually the way it does with age. It stops, often quite sharply. You will have normal hair growth above a certain point on the leg and almost none below it. This is a vascular warning sign. It means the peripheral arteries feeding your lower extremities have been compromised. In medicine, we call it peripheral arterial disease, and its number one cause in seniors is diabetes. That was sign number 7. I told you it would surprise people. The comment section on videos like this always fills up with people saying, "I thought that was just aging." It is not just aging. Now go back and look at the first 6 signs. If you have 2 or more of what we have covered so far, please keep watching, and please talk to your doctor this week. Sign number 8. Persistently cold feet, even in a warm room. Not cold hands and feet together in a cold room. Specifically, cold feet that stay cold even when the rest of you is warm. Even after a hot bath. Even with thick socks on. Your feet stay warm because they receive a constant supply of warm blood from your circulatory system. When diabetes damages and narrows the arteries feeding your lower extremities, less warm blood reaches the feet. And the result is exactly this. Feet that feel cold from the inside, all the time, regardless of external temperature. Here is a quick self-test. Place your hand flat against the sole of your foot for 5 seconds. Then move that same hand to your calf, 5 or 6 inches above the ankle. Is your foot noticeably colder than your calf? A significant temperature difference between the foot and the lower leg in the same limb is a vascular signal worth mentioning to your doctor. Sign number 9. Cramping or stabbing pain in the feet or calves when walking that stops completely when you rest. This one has a very specific pattern that separates it from ordinary foot pain or arthritis. The pattern is this: pain that comes when you walk and stops when you rest. You might feel it as a cramping in the foot or calf, sometimes a burning or stabbing feeling. You push through it, but it gets worse. You stop and sit down, and within 1 or 2 minutes it is completely gone. Then you walk again, and it comes back at roughly the same point. This specific on and off pattern has a medical name, intermittent claudication, and it is one of the clearest signs of peripheral arterial disease, narrowed arteries that cannot supply enough blood to your leg muscles during the increased demand of walking. People with diabetes are up to 4 times more likely to develop this condition than the general population. It is not something to walk through and hope gets better. It is a signal that your peripheral circulation needs medical assessment because without treatment, this can progress to more serious complications. Now drop your age in the comments below. Just your age. I read every single comment on this channel, and after you do that, go back and count how many of the 9 signs we covered today apply to you. Now that we have gone through all 9 signs, I want to be completely honest with you about something. Having one of these signs does not mean you have diabetes. Some of these signs have other causes, but if you counted 2, 3, 4, or more of these signs in your own feet during this video, that pattern matters, and you deserve to know. Here is exactly what I want you to do in the next 7 days. Tonight, do the full foot check we discussed, all 9 signs. Take 10 minutes and actually look. Write down anything you noticed. This week, ask your doctor for a fasting blood glucose test and an HbA1c. These are simple, inexpensive blood tests. A fasting glucose of 126 milligrams per deciliter or higher, or an HbA1c of 6.5% or higher, indicates diabetes. Between 100 and 125 is prediabetes. Both are actionable. Both are treatable. If you have any wound on your feet that is not healed in 2 weeks, do not wait for a routine appointment. Call this week. This specific issue needs prompt attention. And right now, before you do anything else, share this video. Not tomorrow, right now. Send it to one person you care about, your spouse, your sibling, your adult child, your best friend. If this video helps even one person catch diabetes 2 years earlier than they would have otherwise, That is everything. If you made it this far, I want you to know something. The fact that you are watching this, that you took the time to check your own feet during this video, that you are paying attention to your health at this stage of your life, that matters. Diabetes caught early is manageable. In many cases, pre-diabetes is fully reversible with the right changes. The 9 signs we covered today are your body's way of asking you to pay attention before the bigger conversation needs to happen. Hit the like button if this video gave you something useful today. Subscribe to this channel because every single week I bring you exactly this kind of clear, practical health information that your doctor often does not have time to sit down and explain. And please, send this to someone who needs to hear it, not tomorrow, today. I will see you in the next video.